Assalamualaikum and good morning to one and all. Today we'll study about part 2 of antipsychotic drug. So before going ahead, let's quickly revise what we have studied in part 1 of antipsychotic drug. So in part 1, we have studied what is psychosis, its clinical manifestation. So we have seen the positive symptom and negative symptom, and we have studied neurochemical theory, in which we have studied that there are three neurotransmitters which generally affect in case of psychosis. First one, it is the dopamine. So the level of dopamine, it is increased in case of psychosis. So if you want to have antipsychotic action, then in such case your drug must reduce the level of dopamine. So it must have action on the dopaminergic receptor. Second neurotransmitter we have studied was the glutamate. We have seen that decrease in level of the glutamate, it produces the psychosis. So the drug, in order to have antipsychotic action, it should increase the level of the glutamate, or it must activate the glutamate receptor. And third neurotransmitter, that was 5-hydroxytryptamine, especially the 5-HT2 receptor. So in case of 5-HT2, increase in level of 5-HT2, it produces the symptom of the psychosis. So in order to have antipsychotic action, drug must have antagonistic action at dopaminergic receptor, 5-HT2 receptor, and agonistic action, especially in case of the glutamate receptor. So this part we have studied in case of part 1 of antipsychotic drug. In today's lecture, before that, I am Professor Sheikh Abu Sufyan. Welcome you to AS Academy Learning Forever. At the end of this e-learning session, you are able to classify antipsychotic drugs and discuss its pharmacology and adverse effects. Let's start with antipsychotic drug. So first we will see what are the synonyms of antipsychotic drug, because in examination the question it is asked with different name. Okay, so the antipsychotic drug, they are also known as neuroleptic. So first synonyms, it is the neuroleptic. Second synonyms, it is anti-schizophrenic, because schizophrenia, it means it is the psychosis. So those drugs which produces anti-schizophrenic action, they are also called as antipsychotic drug. So second synonym, it is the anti-schizophrenic, and third synonym, it is a major tranquilizer. So must remember that the antipsychotic drug, they are called as a major tranquilizer. And don't get confused. In exam, question may come like write pharmacotherapy of major tranquilizer, or sometimes they might ask the question write pharmacology of the minor tranquilizer. So remember that the major tranquilizers are antipsychotic drug, whereas minor tranquilizer are anti-anxiety drug. So minor tranquilizer are not antipsychotic drug, they are anti-anxiety drug. So this is for your clarification and understanding. Let's see in case of antipsychotic drug, which action it is very important. So we have already studied the neurochemical theory, and in neurochemical theory we have studied that three type of neurotransmitter are affected by the psychosis, are affected in case of psychosis. So the pharmacologically, antipsychotic drug are characterized as dopamine receptor antagonist, because level of dopamine it is increased in case of psychosis, and you want to reduce the level of the dopamine, or you want to normalize the level of dopamine. So pharmacologically, antipsychotic drug, they are characterized as dopamine receptor antagonist. Okay, also they having action on other target, particularly on 5-HT receptor. So in case of 5-HT, especially 5-HT2 receptor, they also having pharmacological action. So pharmacology, if you talk about the pharmacological classification of antipsychotic drug on the basis of pharmacological action, then antipsychotic drug must have dopamine receptor and 5-HT receptor antagonistic action. Okay, let's see about classification of antipsychotic drug. So in case of the classification of antipsychotic drug, there are two categories of antipsychotic drug. First category, it is classical, typical antipsychotic. Okay, so there are two terms here. First one, it is the classical, and second term, it is the typical. So when we study the side effect, you will come to know what is different between typical and atypical antipsychotic. So first category, it is the classical and typical antipsychotic drug. So these are the first category of the drug. These are further classified based on their chemical structure. For example, first category, it is the phenothiazine. So all those drugs which having the basic chemical skeleton of the phenothiazine, they come under the category of first, that is phenothiazine. So example, it is the chlorpromazine and triflupromazine. So if you see here, I have highlighted the some part of the name of this drug in the red color. So what this indicate? So those drug which end with the suffix promazine, it indicate that these drugs are belong to the category of the phenothiazine. So it means their basic structure, it is the phenothiazine. So easy to remember, chlorpromazine, triflupromazine. The drug which is end with the suffix promazine, they belong to the category of the phenothiazine. Second category, it is the butyrophenol. So again on the basis of the chemical structure. So butyrophenol, example, it is the haloperidol and trifluperidol. So here you can see they end with the suffix peridol. So when drug which is end with the suffix peridol, it's belong to the category of the butyrophenol. Okay. Third category, it is the thioxanthine. Example, it is the flupenthixol and clopenthixol. So they end with the suffix penthixol. So the drug, if it is end with the suffix penthixol, it means these belong to the category of the thioxanthine. So their basic structure, chemical structure, it is the thioxanthine. Okay. So the first category, it is the classical, typical antipsychotic drug. Based on their chemical structure, they are classified as a phenothiazine, butyrophenol and thioxanthine. Second category, it is the atypical antipsychotic drug. So just here A is added. So first category, it is typical. This category, it is the atypical antipsychotic drug. Example, it is the clozapine and risperidone. So here there is no chemical classification. So this is the miscellaneous category. This is based on the side effect. Those drugs which having extrapyramidal side effect, they belong to the category of the typical antipsychotic drug. Those drugs which does not have extrapyramidal side effect, they are classified as atypical antipsychotic drug. So later on we will see what do you mean by extrapyramidal side effect. Okay, so this is all about the classification of antipsychotic drugs. Let's see about the mechanism of action of antipsychotic drug, how antipsychotic drugs works, and they produces antipsychotic action. So basic action of all antipsychotic drug, it is their antagonistic action at the D2 receptor. So action at the D2 receptor, it blocks this D2 receptor, and due to blockage of D2 receptor, although the dopamine which is present in your brain, it will not activate the dopaminergic receptor, because the chlorpromazine, it has blocked this D2 receptor, right? So dopamine may be there in the brain, but it will not able to activate the dopaminergic receptor, and it will not produces the symptom of the psychosis. So first basic action, it is action on the D2 receptor. In addition, it block other monoamine receptor, example the 5-HT, because we have seen the level of the 5-HT, it is increased in case of psychosis. Level of dopamine, it is increased in case of psychosis. So on both the receptor, that is dopamine D2 receptor and 5-HT receptor, it produces antagonistic action, or it block both D2 receptor and 5-HT2 receptor. Although it block both these two receptor, and which is also responsible for antipsychotic action, right? But this is not only the receptor which is responsible for antipsychotic action, and this is witnessed by the action of the clozapine. Now you can see the clozapine, it is not acting on the D2 receptor. What it does, it blocks D4 receptor, right? And although it is not blocking D2 receptor, it is not blocking 5-HT2 receptor, but it also having antipsychotic action. Okay, so basically the antipsychotic action of any drug, it's although it's block D2 receptor, it block 5-HT2 receptor, and it also block D4 receptor, but the antipsychotic potency of any drug, it's run parallel with D2 receptor blockage. Okay, so the antagonistic action at D2 receptor, it is very important and play a vital role in order to produce antipsychotic action. Okay, so I hope it is clear to you. So most important receptor here, it is D2 receptor, because antipsychotic potency, it is run parallel with the D2 receptor. Means if the drug having more antagonistic action at the D2 receptor, it is more effective antipsychotic drug. Okay, so this is about the mechanism of action. Other activity include although it having antipsychotic action due to its action on D2 receptor, 5-HT2 receptor, and D4 receptor, but there are many antipsychotic drugs like chlorpromazine. We'll study now. We'll see that it having action on, in addition, also it having action on other receptor as well, like it produce action on the acetylcholinergic receptor, it produce action on the histaminergic receptor. So the activity on the other receptor or other activity, it determine the side effect profile. Okay, so the desired action or the action which is desirable in case of the psychosis, it is first one, it is the dopamine, and second one, it is the 5-HT2. Okay, so 5-HT and dopamine, it is very important action, whereas action on the other receptor, okay, which is other than dopamine and 5-HT receptor, it determines the side effect profile of that particular medicine. So let's see with pharmacological action, and you will come to know how it produces the side effect due to its action on other receptor in the brain. Okay, so first category of the drug, the phenothiazine, and that is example, it is the chlorpromazine. So it is prototype drugs. So we'll study their pharmacology in the detail, and their pharmacology, it is also applicable to the some certain extent for other antipsychotic drugs. Okay, so mechanism of action, so it block the action of many receptor, it block the action of the dopamine, it block the action of the histamines. As I have mentioned, the drug in the central nervous system, it not only blocks specific receptor, it blocks many other receptor also. So you can see here the chlorpromazine, it blocks histaminergic receptor, which is not a desirable action. That action, it is not actually required. Okay, so it blocks dopamine receptor, histamine receptor. It also blocks the catecholamine like noradrenaline, acetylcholine, and 5-HT. Okay, so it blocks acetylcholine also, and it also blocks the 5-hydroxytryptamine receptor. So it having desirable action which is on the dopamine, and secondly it is on the 5-hydroxytryptamine. Okay, whereas you don't want action on the histamine, catecholamine, and acetylcholine. Since it having action on histamine, catecholamine, and acetylcholine, it will produce the more side effect. And since it produces the action on many receptor in central nervous system, okay, so what it means? It means it having the multiplicity of the action. So due to this multiplicity of the pharmacological action of the chlorpromazine, it is called as the Largactil. So those who are preparing for GPAT point of view, you must remember that the chlorpromazine, it is called as the Largactil. Why it is called as Largactil? Because it having multiplicity of the action. It does not act only on the one receptor, but it having pharmacological action on multiple receptor, and due to this multiplicity of pharmacological action of the chlorpromazine, it is called as the Largactil. Okay, so we have seen about mechanism of action and why it is called as the Largactil. Let's start with their action. First action, it is the behavioral effect. So the psychosis, it is basically the disease which affect the behavior. So behavioral effect of the chlorpromazine, it is studied on experimental animal. And when the chlorpromazine it is given to the experimental animal, it is observed that it reduces spontaneous motor activity. So one of the symptoms of the psychosis, it is the stereotype behavior. Okay, so what is stereotype behavior? I have given few examples, like person it is moving from here to there, maybe left to right or right to left, or hair combing for the multiple time. So what is this? This is spontaneous motor activity. If this is happening suddenly, that is one of the positive symptom of the psychosis. So this is what we have seen in case of the last lecture. In case of the animal, it is observed by the movement of the animal. If animal movement in the cage, especially when it is put into the activity cage, if the movement it is increased, their motility it is increased as compared to the normal animal, that indicate that there is increase in spontaneous motor activity, which is one of the symptom which is similar to the stereotypic behavior seen in case of the human being. So when antipsychotic drug like chlorpromazine it is given, it is observed that it reduces spontaneous motor activity, which is indicator of its antipsychotic action. Okay, so reduced in spontaneous motor activity, in case of the animal it is indicator of antipsychotic activity, right? But it does not only produces reduce in spontaneous motor activity. In addition to that, when you give the chlorpromazine at the large dose, means therapeutic dose, it produces reduce in spontaneous motor activity. But when you give chlorpromazine at larger dose, maybe at the toxic dose of the chlorpromazine, it produces the catalepsy. So catalepsy, it is the condition where the movement it is reduced and the movement it is sometimes ceased. Now if you look at this animal, this animal it is standing, right? So if it is standing with his forepaw up, so when its forepaw it is up and he is standing, and animal unable to bring his forepaw down, what it means, there is resistance to the movement. Okay, the animal is not able to move the movement. Like if you have raised your hand and if you want to bring your hand down, you want to bring down your hand, but you are not able to do that because there is resistance to your movement. So this condition it is indicate the catalepsy. Okay, so at large dose it causes the catalepsy, which is the indicator of the extrapyramidal side effect. So as I have mentioned, the typical antipsychotic drug they are having extrapyramidal side effect, whereas atypical antipsychotic drug that does not having extrapyramidal side effect. So we'll see the reason why typical only have this side effect, why there is no side effect of why there is no extrapyramidal side effect in case of atypical antipsychotic drug. Okay, so behavioral effect we have seen. Second effect, it is the aggressive tendency. So aggressive tendency, it is one of the positive symptom of the psychosis. So aggressive tendency, it is the strongly inhibited. Okay, so that patient become calm down and this aggressive tendency it is strongly inhibited. So that is the desirable effect. Whereas the patient suffer from state of apathy. What do you mean by apathy? Means the patient lose the interest. So there is loss of interest and the reduced in initiative. He will not take the initiative. So if you want to ask, or if you ask your friend who is the good in playing the cricket, and he's so enthusiastic that when you ask him to come to play the cricket, he is get motivated and he is get excited, isn't it? So this was his earlier behavior. But in case of state of apathy, no matter whatever you say, or you call him for playing the cricket, give him batting or the bowling, whatever he interested in, but he will not take the initiative, isn't it? Because there is loss of the interest and reduced initiative. This indicates there is the state of apathy. One more action of the chlorpromazine, it is anti-emetic action. Why it produces the anti-emetic action? So anti-emetic action, it reflects their antagonistic action at dopamine receptor in intestine. Okay, so MSCs, that is the vomiting or the nausea, why it happen? Because there is increase in GI motility due to increase in level of the dopamine. Since it produces antagonism of the dopamine, so it produces antagonism of dopamine not only in the CNS, but it produces their antagonism also in case of the intestine. Okay, so since it produces the antagonism of dopamine in intestine, it produces the anti-emetic action, because excessive action of dopamine in intestine, it is responsible for the MSCs or the vomiting. Okay, and since it blocks the dopaminergic receptor in intestine, it produces the anti-emetic activity. Let's see what are other action. Other action including antihistaminic action. So it produces the antihistaminic action, and this antihistaminic action we'll see later on. It is responsible for the sedative property or sedation which is produced in case of the person who is taking chlorpromazine or antipsychotic drugs. Let's see unwanted effect. So we have seen the pharmacological action, different pharmacological action of the chlorpromazine. Now we'll see what are the unwanted effects. So as we have seen, chlorpromazine act on many receptors. So action on dopamine and 5-HT2 only produces the antipsychotic action. Whereas action on the other receptor, it is responsible for its side effect or the side effect profile. Okay. So there are many side effects produced by chlorpromazine. but it produces two main side effects, two very severe side effects which is produced, and where there is means patient suffer from the motor disturbance. So it produces the motor disturbance, so that is very severe and embarrassing to the patient. So let's see what are those side effects. So first side effect, it is acute dystonia, and second side effect, it is tardive dyskinesia. These side effects, they are collectively called as extrapyramidal side effect. So we have seen the chlorpromazine, when it is given to the animal at large dose, it produces extrapyramidal side effect. So there we have only studied extrapyramidal side effect. But what do you mean by extrapyramidal side effect? The animal or the patient starts showing acute dystonia and tardive dyskinesia. So let's see what it is. So first, it is before going ahead, remember that this extrapyramidal side effect, it is result from D2 receptor blockage. So there is the blockage of D2 receptor, not only everywhere in the brain, but it produces the D2 receptor blockage, especially in case of nigrostriatal pathway. Okay, and since it produces the extrapyramidal side effect, which is the main disadvantage of classical antipsychotic drug, those antipsychotic drug, they produces extrapyramidal side effect. They are called as typical. Okay, so they are called as typical antipsychotic drug. Why they are called as typical antipsychotic drug? Because they produces extrapyramidal side effect, which is main disadvantage of classical antipsychotic drug or the typical antipsychotic drug. Okay, whereas atypical antipsychotic drug show less tendency to produce extrapyramidal side effect. Okay, so remember that atypical antipsychotic drug, they does not produces, or all it may produce, but they having the less tendency to produce extrapyramidal side effect. Okay, so this how your typical and atypical antipsychotic drugs, they are classified based on extrapyramidal side effect. So typical antipsychotic drug, they produces extrapyramidal side effect, or typical antipsychotic drug, they show less tendency to produce extrapyramidal side effect. So let's see first adverse effect of chlorpromazine or antipsychotic drug. So first one, it is acute dystonias. So what happens in case of acute dystonia? So it is characterized by involuntary movement, which is occur commonly in the first few weeks and decline with the time. It means it start when treatment it is started, and when you continue the treatment slowly or gradually, the patient will not show the symptom of acute dystonia. So the treatment of this typical antipsychotic drug or classical antipsychotic drug, it is basically depend on how patient tolerate this side effect. So if he can tolerate the side effect, then when you continue the treatment, he will not suffer from acute dystonia. Okay, so let's see what are the symptoms which is seen in case of acute dystonia. So first symptom, it is the muscle spasm. So there is the spasm of the muscle, then protrusion of the tongue. So tongue, it is coming out, which is very embarrassing to the patient. So protruding tongue, and often Parkinson type syndrome. What do you mean by Parkinson type syndrome? Like muscle rigidity, pill rolling movement, okay, of your limbs. So these type of symptoms are seen in case of the acute dystonia. When the symptoms are seen in the patient, and you know that the symptoms are due to the medication, that is due to the chlorpromazine. So when you stop the drug treatment, this acute dystonia, it is reversible. So acute dystonia, it is reversed when you stop the drug treatment of the chlorpromazine. But here problem is not solved, because when you stop the treatment, what will happen? Okay, so although it reverses the symptom, but it reverses the symptom of the acute dystonia, but it starts showing the symptom of the psychosis. So only stopping the drug treatment, it is not the solution for the treatment of the acute dystonia. Okay, so let's see how it produces. Why that only typical antipsychotic drug, they produces the acute dystonia. So in case of typical antipsychotic drug or the chlorpromazine, it produces the blockage of dopaminergic receptor in nigrostriatal pathway. So we have seen in case of Parkinsonism level of dopamine, it is decreased exactly in nigrostriatal pathway. Okay, and these drugs they block dopaminergic receptor in nigrostriatal pathway. Since it block dopaminergic receptor in nigrostriatal pathway, they often produces Parkinson type syndrome. Okay, so I hope you got it, because it block nigrostriatal dopaminergic receptor at nigrostriatal pathway, and whatever symptoms are produced, they are called as extrapyramidal symptoms, because it is due to blockage of dopamine in extrapyramidal pathway or nigrostriatal pathway. A typical antipsychotic drug, interestingly, they does not produces antagonistic action of the dopamine at nigrostriatal pathway. They act at mesolimbic and mesocortical pathway. Okay, so they block the dopaminic receptor in mesolimbic and mesocortical pathway and diminish risk of acute dystonia. Since it doesn't block dopamine receptor at nigrostriatal pathway, it does not produces the acute dystonia. It is acting on mesolimbic and mesocortical pathway, where their action on dopamine receptor at this pathway, it does not produces the acute dystonia. So this is the reason why typical antipsychotic drug they produces extrapyramidal side effect, and why a typical antipsychotic drug they does not produces extrapyramidal side effect, because their action it is not on extrapyramidal pathway. So first symptom we have seen, that is acute dystonia. Second symptom, it is tardive dyskinesia. So very important, exam sometime only question it is come on adverse effect of the chlorpromazine or an adverse effect of antipsychotic drug. Okay, so second symptom, it is tardive dyskinesia. It is developed after month or the year, hence it is called as the tardive. Tardive means it is something which is the delay and very severe kind, so we call it as a tardive because it develop after months or the year. It is not seen in all patients, it is seen in case of 20 to 40% of patients. So in the patient in which they show this side effect, it is very difficult to tolerate. Okay, let's see how is the nature of the tardive dyskinesia. Remember that tardive dyskinesia, it is of the serious nature. It is highly disabling and often irreversible condition. Why it is serious? Because it is irreversible condition. It is not reversed. So any side effect, if it is reversed, then that is not a severe in nature. Whatever it produces, it sometimes produces permanent damage to the nerve. Okay, so it often irreversible condition, get worse when antipsychotic therapy stops. So neurology doesn't understand what to do, whether to stop the treatment or whether to switch over to the another drug. So if you stop the treatment, it become a worse. Okay, and it is resistant to the treatment, so that is very dangerous. Means although you are giving the drug, it will not reverse, so it is resistant to the treatment. So due to this nature of the tardive dyskinesia, the tardive dyskinesia, it is one of the serious symptom of the of antipsychotic drug. Okay, let's see what are the syndrome. So syndrome scenes are involuntary movement of the face and tongue, which is very embarrassing. So if you want to say something and if your tongue it is not in your control, you will not able to talk, you will not able to speak. So there is involuntary movement of the face and tongue. There is involuntary movement of the limb. Now you can see you are sitting in the chair and suddenly there is movement of your hand, there is movement of your legs, and you are sitting with your friend. What friend will think, isn't it? So sometimes it is very embarrassing, there is no control on your limbs. So these are the symptoms of the tardive dyskinesia. Okay, so it resembles that seen after prolonged treatment with the levodopa. So when you do the long-term treatment with the levodopa also produces the dyskinesia. Okay, that is involuntary movement is also seen in case of levodopa. So it is similar or in the nature it is something similar to that type of dyskinesia which is produced in case of the levodopa. But remember that the dyskinesia which is produced by the levodopa, it is not having severe nature, whereas in case of tardive dyskinesia, it is of the serious nature. Okay, so we have seen the two important adverse effect of the antipsychotic drug. Now we'll see additional action. What are the additional adverse effect of the chlorpromazine? So one adverse effect, it is the action on the endocrine effect. So it increases the plasma prolactin concentration. So remember that the prolactin, it is generally released after delivery of the baby. So after delivery of the baby, the prolactin it is released in case of the mother. So in the mother blood, prolactin level is released, and this release of the prolactin it's responsible for the breast swelling, the pain and lactation. So this is the natural case in case of the mother, because the baby it is delivered, so that baby want the milk. So as a rule of the nature, there is release of the prolactin. But now if this prolactin it is released without delivery of the baby, or you can imagine it is releasing in case of the male. So in case of the male, there is no reason for releasing the prolactin, but when the chlorpromazine it is taken, the chlorpromazine it causes release of plasma prolactin level in case of the man as well as the woman, which is responsible for the breast swelling, pain and lactation, which is very embarrassing condition to that particular patient. So the endocrine effect it is release of the plasma prolactin level, increase in a plasma prolactin concentration result in a breast swelling, pain and lactation. Other unwanted effect it is sedation. So the sedation it is seen in case of the patient who is on treatment with the chlorpromazine, but it is observed that the sedation it is decreased with continuous use of the chlorpromazine. Okay, so if you continue the use of the chlorpromazine, slowly the sedation will decrease. So we have seen already why sedation is there, because sedation it is due to antihistaminic action of the chlorpromazine. So you remember that it is due to antihistaminic action of the chlorpromazine. In addition, we have seen it block cholinergic receptor. So in case of cholinergic, particularly block muscarinic receptor. Due to that, it produces all anti-muscarinic side effect like the blurred vision. It produces increase in intraocular pressure. It produces the dry mouth and eye, constipation and urinary retention. So these are the common anticholinergic side effect which is seen with all anticholinergic drug, and it is true with chlorpromazine as well, because it blocks muscarinic receptor, right? Whereas the blocking of alpha adrenoreceptor it produces the hypotension, because the adrenaline level or activation of the adrenaline it is responsible for the increase in heart rate and force of contraction and maintaining the blood pressure. Since it blocks alpha adrenoreceptor, it produces reduced in blood pressure, that is called as the hypotension. In some patients, it is observed that this drug produces the weight gain. So weight gain it is the common and troublesome side effect of the chlorpromazine, because after certain age you don't want obesity. Let's see why it produces the weight gain and which receptor it is responsible for the weight gain. So it is seen in case of atypical drug, and it is related to 5-HT antagonism, because 5-HT antagonism, due to antagonism of the 5-HT receptor, it increases the hunger in that patient. Okay, so the hunger it is increased due to the blockage of 5-HT receptor. As a result of that, more food will be consumed by that patient, and he may suffer from the obesity or the weight gain. So this is again a discomfortable side effect of the chlorpromazine or antipsychotic drug. Few more adverse effect like the jaundice. So you can see it having less pharmacological action or less desirable effect and more what we'll say adverse effect. So the jaundice it is seen with the older phenothiazine, example chlorpromazine, and it is not seen in case of the new drug. It may be due to its bad effect on the liver. In addition, it produces the leukopenia and agranulocytosis. So leukopenia it is decrease in level of the WBC. So decrease in level of the WBC is called as leukopenia. Agranulocyte it is decrease in level of agranulocyte. So all these decrease in agranulocytes are also WBCs. So since it decreases the level of WBCs and agranulocyte, it produces the opportunistic infection in that patient, because their immunity is decreased. Okay, so it is rare but the potential fetal side effect, because it produces the risk of opportunistic infection. So it is not seen in case of all the drug, but it is seen in case of atypical antipsychotic drug, that is clozapine. So that is very dangerous, because their immunity is decreased and that patient may suffer from opportunistic infection. Urticaria and skin reaction, it is common but usually mild in nature. So although it is mild in nature, but in the patient in which this reaction it is seen, it is not tolerable. Okay. Antipsychotic malignant syndrome. So it is again common antipsychotic. It is common syndrome or and adverse effect which is antipsychotic drug. So it produces the muscle rigidity. It is accompanied by the rapid rise in the body temperature. So that is why it is called as malignant syndrome. So rapid rise in the body temperature and produces the mental confusion. So the muscle rigidity, rapid rise in the body temperature and mental confusion, if these symptoms seen together, they are called as antipsychotic malignant syndrome. So this is all about adverse effect of the chlorpromazine. Let's quickly see about the clinical uses and efficacy of the antipsychotic drug. So I am going little fast because here there is nothing to explain. So remember that the first clinical use, it is in case of acute schizophrenia, but in acute schizophrenia you need large dose. So large dose it is needed for the treatment of acute schizophrenia. And very important point in case of treatment with the psychosis is that the preventing reoccurrence of the schizophrenic attack, it is the major factor to lead normal life. Otherwise, if you are given treatment for a month or maybe you are given the 2 months, and when you gradually stop the treatment, and if psychosis or schizophrenia, if it is reoccur, then there is no use of that treatment. Okay, so your treatment must be such that it should prevent reoccurrence of the schizophrenic attack. So that is major factor to lead normal life. So let's see what is its effectiveness, whether that is happen or not. Okay, so it is observed that it is not effective in improving negative symptoms. So negative symptoms are not improved by giving the antipsychotic drug. Approximately 40% of the patient, they are poorly controlled by antipsychotic drug. It means it produces the effect only in case of the 60% of patient, and 40% of patient, they are resistant to the treatment of antipsychotic drug. So if you have identified such patient, so you have identified the patient who are not responding to the treatment with the typical antipsychotic drug, then in such patient you can give the clozapine. So clozapine, it is effective in antipsychotic resistant patient. So these 60% of patient who are resistant to the treatment with the chlorpromazine, you can give the clozapine. So again, alternate option is available. So first you can start the treatment with the chlorpromazine because it is the first choice drug, and those patients who are not responding to the classical antipsychotic drug, those are called as antipsychotic resistant patient. In those cases you can give the clozapine. Okay, so to summarize, very important thing is that in case of acute schizophrenia you need a large dose. Very important thing, it is preventing the reoccurrence of schizophrenic attack. Its effectiveness, it is not effective in improving negative symptom. You need to give some other medicine for the treatment of negative symptom. Okay, and it is approximately its effect, it is only in 40% of patient, whereas 60% of patient, they are resistant to the antipsychotic treatment. So in such case, what you can give the clozapine. The clozapine, it is effective in antipsychotic resistant patient. Let's see what are the other uses. These are also used for the treatment of the anxiety, but remember that when you are giving this drug for the treatment of anxiety, it should not be used for the simple anxiety. Why? Because this drug, it produces autonomic and extrapyramidal side effect. So if the anxiety which having the simple nature or which is the normal or regular type of anxiety, you can give the benzodiazepine. Okay, that is the regular anti-anxiety drug. So benzodiazepine can be given in case of the patient who are having the simple anxiety. Okay, let's see in which case of anxiety you can use the chlorpromazine. However, those not responding, so those not responding to the benzodiazepine, or the patient, it is benzodiazepine resistance. Okay, so those not responding to the benzodiazepine or having psychotic basis for anxiety, in such cases they may be treated with the neuroleptic drug. Otherwise, in case of simple anxiety, you are only giving benzodiazepine. Those who are not responding to benzodiazepine or the anxiety, it is due to psychosis, then in such case you can give chlorpromazine for the treatment of that kind of anxiety. Next use in case of the mania. So mania, it is the aggressive behavior. This is one of the symptom of bipolar disease where patient become manic and depressed. So their behavior, it is swing from suddenly become aggressive and then suddenly he become a depressed. So to stabilize the mood, you are giving the drug. So in such case, you are not giving chlorpromazine or haloperidol as an individual drug. So if patient is suffering from the mania, then chlorpromazine or haloperidol, it is given intramuscularly, so it produces the action within 1 to 3 days. In addition to this, you can also give lithium or valproate. So chlorpromazine and haloperidol along with lithium and valproate, you can start simultaneously for the treatment of the mania. So remember that it is not given as a single drug for the treatment of the mania. It is given in combination with the lithium or valproate for the stabilizing the mood of that particular patient. Few more use, like it is used as antiemetic, we already seen, because it blocks the dopamine receptor in the intestine, it produces the antiemetic action. Other uses to potentiate hypnotic, analgesic and anesthetic action. So it is given only in case of the anesthetic practice. So we have seen one of the pre-anesthetic medication, it is the chlorpromazine. So we have studied in case of the anesthesia chapter. Why you are giving chlorpromazine? Because it potentiates the hypnotics, analgesic and anesthetic action. These are ideal property of one of the good anesthetic. Since it potentiates this action, you can give the chlorpromazine along with other anesthetic drugs, so to potentiate their action. Last one, it is in case of the tetanus. So tetanus, it is increase in the tone, muscular tone, so it is very dangerous and sometimes it produces very severe pain. So a patient having the tetanus, then chlorpromazine, it is given as a secondary drug to achieve skeletal muscle relaxation, because chlorpromazine produces relaxation of the skeletal muscle. So the increase of the tone, it is reduced by the chlorpromazine. So this is all about today's chapter. So I have referred this chapter. I have referred these two books, that is H.P. Rangendale and K.D. Tripathi, for gathering the content of my slide deck. Okay, so you can go at home and you can refer to these books for studying this chapter. Okay, so let's go to the question and answer. So we'll revise our session with the Q&A. I know I am little late, but I will quickly finish with the Q&A. So my first question is, give any two synonyms of the psychosis. Give any two synonyms of the psychosis. We have seen three synonyms. Yes, I am waiting for your answer. Neuroleptic drug, anti-schizophrenic. Aksa has given the answer. Saki, right answer. Very good. Ansari Farzin, Safa Dabir. Yes. So it is the neuroleptic anti-schizophrenic, not a schizophrenic. It is neuroleptic anti-schizophrenic. And third name, it is major tranquilizer. So these are the synonyms of antipsychotic drug. My next question, among spontaneous motor activity and catalepsy, which one is extrapyramidal side effect of the chlorpromazine? Among spontaneous motor activity and catalepsy, which one is extrapyramidal side effect of the chlorpromazine? Catalepsy, right? Aksa given the right answer. It is the catalepsy. I want everyone to be active. Quickly you have to give the answer. Don't wait for other to give the answer and then you are repeating. Yes. Nida, Urus, Fatima, Uzma Qureshi, Gajanan. Okay, right answer. Sahara, Anjuman Logde. Right answer, it is catalepsy. My third question is, give one endocrine side effect of chlorpromazine. Give any one endocrine side effect of chlorpromazine. What is the endocrine side effect of chlorpromazine? Very good. Nurun Nisa, Aksa Kazi. Increase in plasma prolactin level that produces the swelling of the breast. There is the pain and there is the lactation. Okay. So this is due to increase in plasma prolactin level. So it is very embarrassing side effect, endocrine side effect of the chlorpromazine. My next question: what is the scientific term for involuntary movement associated with treatment of chlorpromazine? So we have seen few side effects of the chlorpromazine where there is involuntary movement. So what is the scientific term for the involuntary movement which is associated with the treatment of the chlorpromazine? Yes, Ansari Farzin, right answer. So only Farzin has given the answer. It is acute dystonia. Spelling mistake is there. It is acute dystonia. Okay, so acute dystonia, so tardive dyskinesia also there is involuntary movement. So in both the cases, if you see the involuntary movement, so these are associated with your chlorpromazine. My last question: give few clinical uses of psychosis. I'm correcting the question. Give few clinical uses of antipsychotic drug. So there is a typographic mistake is there. I'm correcting that. Give few clinical uses of antipsychotic drug. So there are many clinical uses are there. You need to write only few clinical uses. Okay, acute schizophrenia we can use. We need to give the large dose of antipsychotic drug. What are the other clinical uses? I want more clinical uses. Anxiety. So the anxiety which is resistant to the benzodiazepine you can give. Very good. Mania you can give. So in case of mania you can give it in combination with valproate and the lithium. Nice. Antiemetic drug. Shaista has given the answer. It having antiemetic action because it blocks dopamine receptor in intestine. Very good. What are the other uses? Yes, tetanus. Tetanus. Very nice. So why we are giving in case of tetanus? Because in tetanus there is increase in the muscle tone. So we are giving it as a muscle relaxant drug. So very nice. I have done with my session. I will be releasing attendance link on the chat box. So thanks for watching my session. If you like this video, then do remember to give me a thumbs up. So thanks. Thank you. So I have released attendance. You give the attendance, then say done, and then you can leave.